Okay, so primary survey to a first person on scene standard. This is considered gold standard for pre-hospital care. So upon arrival at the casualty for our primary survey, the first thing that we're looking for is danger. Danger to ourselves, dangers to our casualties, dangers to anybody else that might be around. We need to ascertain a level of response. You'll recall from training that we use the mnemonic AVPU. Alert. Is the casualty alert? Are their eyes open? Are they looking around? Voice. Do they respond to a verbal command? Pain. Do we need to actually maybe give them a pinch or a bit of a rub or a shove just to see if they respond to it? You. If they're that, they're unresponsive. We then need to look at any catastrophic bleeding. This is something that probably will be massively apparent on your initial approach. Remember, catastrophic bleeding is defined as a life-threatening bleed that we must deal with first. Then airway. So we look inside the mouth to see if there's any debris, any vomit, clear that as required. We open the airway using the head tilt, chin lift manoeuvre or the jaw thrust if we suspect a potential spinal injury. We then carry out our breathing assessment. So we look for no more than 10 seconds to see and establish whether the casualty is breathing and at what rate. Concurrently to this, we can take a carotid pulse just to see that it is present. This will outline an immediate response for cardiopulmonary resuscitation or the use of a defibrillator should either be absent. Once we've ascertained that the person is breathing and they are circulating blood, we then move on to disability. This is crucially a check around the head and around the eyes to see whether there's been a traumatic head injury or brain injury that we can do something about right now. Does this patient need to be immobilised or considered to be a potential spinal risk? Moving on from that, we then go on to the expose. Identifying any further bleeds, any broken bones, anything that we can actually do to make this patient more comfortable or less risk of having further complications. Once we have done this, we need to ensure then that the environment remains safe. So we keep reassessing the casualty using the C, A, B, C, D, E approach, which I've just gone through.